Hello, and thank you for joining me for part 2 of Entwistle Power Occupational Therapy's webinar on acquired brain injury and how occupational therapists can help with the assessment and treatment of our clients. My name is Brenda Power Ahmad, and in this section we will talk about how occupational therapy assists with thinking strategies and the management of physical and emotional symptoms. So previously we discussed the definition of acquired brain injury and some of the ABI symptoms and functional implications of our clients that experience acquired brain injury. And in the next section, we will get into more specifically a case example. So in this section, let's start by clearing up the word occupation. The term occupational therapy can be confusing and often carries the misconception that the profession is based solely on work. The term occupation actually includes all activities of daily living, including homemaking, self-care, leisure, and work, for example. The cognitive, emotional, and physical symptoms resulting from the injury result in a wide array of functional challenges for the individual based on their specific environment, their goals, and their abilities. The occupational therapist completes a comprehensive assessment to determine how the injury impacts the individual's ability to complete activities or occupations as they did them prior to their injury or that are important to them. The occupational therapist assesses 3 domains of function, including self-care or personal care tasks such as dressing, grooming, showering, and mobility; productivity, including what individuals do to feel productive, which could include housework, play, school, or employment; and leisure tasks, which include social activities, sports, and activities that people do for fun. So then, what is the occupational therapy role in all of this? Occupational therapists are skilled in the analysis, adaptation, and therapeutic use of occupations to achieve goals jointly determined by the therapist and the client in the context of their own home or community. The occupational therapist assesses the client to determine what interventions are required to assist the individual to resume important and meaningful activities of their life. They do this through various methods that I will now describe. Keep in mind that this is not an inclusive list. Also, interventions vary depending on the stage of recovery and the severity of the injury. The strategies you will use obviously will be different if the person's in a coma or in the acute or the community stage of their recovery, for example. Now I'll go on to describe some of the ways that OTs assist people with acquired brain injuries to resume important and meaningful activities of daily living by minimizing the impact of these cognitive challenges. Based on a thorough assessment to determine the cognitive challenges that are present, the OT may help the client to remediate or improve these deficits. For example, use of computer brain games to remediate attention, memory, or problem solving. Keep in mind the research is mixed in terms of whether or not these computer games actually assist with improved cognition, and personally I prefer to use more actual meaningful functional tasks for these clients, but some people will report benefits to their thinking or attention, and as long as you explain to them that this is not clearly scientifically grounded, then I sometimes will use brain games on rare occasions, depending on the client and their wishes. For functional tasks, the OT is skilled in the treatment of function and will choose specific tasks that will remediate deficits through use of the activities that are important or meaningful for the client. For example, if the client wants to go back to school, the occupational therapist will develop a program based on the client's specific goals that will assist with attention, memory, and executive function as it's needed to perform well in these school tasks. This might involve repetitive practice of simulated activities, for example, using specific strategies and tools. The OT may also use compensatory strategies, which are methods of compensating for the impaired cognitive skill. For example, if the client frequently forgets appointments, an alarm or a calendar can be utilized. If the client is unsafe to use the stove and the skill cannot be taught, a stove guard or an automatic shutoff can be implemented, or an iPad can be programmed with compensatory strategies related to a variety of functional skills. Often, remediation and compensation are used together in an individualized cognitive rehab treatment program. So let's talk about some examples of these thinking strategies. After a thorough assessment is completed to determine the cognitive deficit, some of these strategies may be used as they relate to functional goals. If the client has an attention deficit, it'll be important to minimize distractions in the environment in which they need to function, for example, at home, at school, in the work or community. They'll need to decrease visual clutter and for instructions to be presented in a clear and concise manner. For example, if the client wants to resume cooking, the client can be taught to lay out all the ingredients ahead of time and to minimize other clutter on the countertop and other visual or auditory distractions while they're cooking. The OT may determine that the client would benefit from structured attention training through programs such as CogMed, but again, keep in mind that the science behind this is debatable. If the client has a memory deficit, a number of strategies can be implemented, including word associations, chunking information, or the use of mnemonics. Assistive devices may be recommended to aid specific functional memory deficits, such as a dosette, a calendar, or a stove guard. Ideally, the OT will implement memory strategies that relate to function, such as tasks required at school, work, or at home. If the client has an executive function deficit, interventions are aimed at minimizing the problem-solving, decision-making, or organization difficulties through use of various strategies, such as goal, plan, do, review worksheets related to activities. This worksheet allows clients to work through a problem slowly and learn from experiences by checking back and reviewing how it went. Over time, the idea is that the client would no longer be required to use the worksheet and would be able to problem solve in the moment as he or she did before the injury. For insight and self-awareness deficits, the OT might customize a treatment program that encourages those that interact with the client, such as their family or other treatment providers, to provide feedback in the moment to enhance self-awareness and insight of the client's deficits. So let's talk about how occupational therapists help with strategies for physical deficits. Once again, based on a thorough assessment of the client's specific functional symptoms combined with their functional goals, strategies may include establishing or restoring functional skills or remediation while continuing to modify the task or the environment through adaptation or compensation. The goal is, once again, to enable continued occupational performance within the constraints of the physical disability, for example, pacing strategies due to ongoing or chronic headache and fatigue. The OT may create a specific intervention plan that allows the client to re-engage in activities that are meaningful for them with the goal to improve physical deficits over time. This may involve working jointly with the physiotherapist, especially if it involves a walking, gym, or swimming program, for example. The OT will select specific compensatory strategies to enhance physical function. For example, assistive devices or technologies such as magnifiers or computer programs to improve function as it relates to home, school, or work tasks due to vision deficit or loss. The OT works collaboratively with the client's employer or the school to develop a specific accommodation plan for these deficits, such as the need to take frequent breaks, sit at the front of the classroom, or modifications to the work schedule. Pacing is an important consideration here, as overdoing it often tends to exacerbate or worsen symptoms. The occupation or environment is modified in an individualized way to support function. Some strategies may include the use of a day planner or smartphones or tablets for scheduling, planning, setting appointments, and the use of alarms. Accommodations at the workplace or the school is another strategy that can be used, along with communication with the school or the employer. Reduced overhead lighting at the client's workplace due to light sensitivity could be tried, along with advocating for needs such as testing in a separate room, a note taker, or use of a recorder for class lectures. So how do occupational therapists help with the emotional deficits that we see many of our clients experiencing? If emotional symptoms are present, often a psychologist is also involved and works jointly with the OT to enhance functional outcomes. A psychiatrist may also be involved for medication management. Psychological and other cognitive and physical symptoms of ABI often negatively interact. Education about sleep hygiene and regular physical activity and engagement in activities is important, which can improve mood, fatigue, and well-being. The OT or the psychologist may offer cognitive behavior therapy, which refers to a combination of strategies to improve function by altering maladaptive thought patterns and behavior. The progressive goal attainment program could be tried and might be beneficial in gradually developing a more structured routine using a behavioral activation approach. Interventions generally include a list of coping strategies to manage symptoms in various functional scenarios. Strategies to manage pain and fatigue are incorporated for maximum benefits, such as pacing strategies. The client may benefit from a mindfulness approach or engagement in specific activities such as yoga to learn to breathe, and relaxation strategies which can then be generalized and used during functional activities. The OT may work with the psychologist to develop a graded exposure program for anxiety triggers, such as driving or walking as a pedestrian. As the OT often works with the individual in their home, community, or environment where they function, the OT may accompany the individual in the community to practice these strategies for maximum benefit. So this is the end of the second part of this webinar. In the next part, I will talk about how occupational therapists take a client-centered approach to assessment and treatment, and we will get into a case example. Again, thanks for watching, and if you'd like to learn more about Entwistle Power Occupational Therapy, please check us out on LinkedIn, Twitter, and Facebook. We also have a very informative blog on our website, which you can check out at www.entwistlepower.com. We also have an AODA customer service training program, and ask us how we can help you become better than just compliant with this AODA legislation.